Maryvale Private Hospital opened to support the workers in the region, and as the private health insurers have merged under the ownership of La Trobe Health Services, it's continued its investment for the community. Most recently, we've invested into the hospital $16 million, which has extended our theatre program, our day surgery centre, theatre recovery, and our consulting services. The ability for us to be able to extend the hospital allows us to continue bringing in pipeline doctors to extend the service for the community, not just for now, but into the future. We've also taken the opportunity to grow our doctor base. So we've brought doctors into the region and also worked with our doctors to grow our junior doctors who are now becoming consultants. We've also had key milestones in our undergraduate programs coming through to our graduate registered nurse programs, working with the local stakeholders to grow our opportunities for education and development. The additional key milestones, particularly for Maryvale, is moving with the times, and particularly in the area of digital integration. We've been working with a number of key stakeholders, including Dr. Vi, to improve the patient experience from when they walk in through the front door to when the patients actually leave. For us, it means moving to online patient admission portals, which will come in the next few months. So with the exception of signing the consent form in the doctor's rooms, all of the patient admission journey will now be completed online. We're currently going through user acceptance testing at the moment, but it's aimed that all of the patient information prior to their admission will be completed via phone, an iPad, or a computer. So it means that we have the most current information available so that our staff can best care for the patients when they walk through the door. The redevelopment itself, though, has been a 10-year process to get to this point. So the community, and particularly the staff, are very excited to see this come to fruition. The hospital redevelopment has allowed us to not only extend our services in terms of size, but also the accessibility of services within the region. It does mean patients are able to access services locally. It means that they're spending less time away from their families, and their families can actually spend time with them whilst they're in hospital. It means less cost, less time on the road, no hotels, but what it does also mean is that patients can receive the same community family experience when walking through the door.